Breaking the Wall of Mental Health Stigma in Kenya. Judy Baariu, Difu Simo Mental Health Engagement Project, Kenya.
Okay, Jambo. So imagine living half of your life chained to a bed or to a tree because you have a mental illness. Well, this was the reality for Mr. Changawa, a 52-year-old man who lived with schizophrenia, which is a severe form of mental illness since he was 15 years old. Mr. Changawa, who sadly passed away in August 2020 due to neglect, was the inspiration for our project. And the story begins about 8 years ago during our field activities for other unrelated field research activities in communities in Kilifi, Kenya. We happened to pass by Mr. Changawa's homestead, and we noticed the conditions that he was living in. Initially, we attempted to assist him alone, but we soon realized that the problem of stigma and abuse of human rights for people living with mental health problems in our community was widespread, and that is how our project, Difu Simo, was born. And people living with mental health problems like Mr. Changawa often face stigma due to lack of knowledge from their families and also the wider community, and also cultural and religious beliefs about the causes and management of these problems. And stigma has significant negative impact on the quality of their life. For instance, it can lead to premature mortality or early death, poor prospects in social relationships such as marriage, and also lack of access to mental health care. For instance, in Kilifi, Kenya, where I work, the causes and management of these problems are often attributed to witchcraft, and people living with these conditions seek care from traditional and faith healers. And our project, Difu Simo, is our mental health awareness campaign that is breaking the wall of mental health stigma in Kenya. And the word Difu Simo is actually a Kigiriama phrase, which means breaking free in English. And we've combined the diverse expertise of stakeholders from different fields. We have researchers, experts in the filmmaking industry, community members with lived experience of mental illness. We also have experts in the local culture and traditions of the local community, biomedical practitioners, and also traditional health practitioners, just to try and understand mental health and mental illness from a community perspective, and also create culturally relevant interventions in engaging communities. And our engagement activities are delivered by community members and mental health practitioners through participatory approaches such as songs, dances, and poems, and also community forums through platforms such as mental health awareness walks. We also have participatory videos, which are created by community members with actual lived experience of mental illness, and these are used to engage the wider community in communities in Kilifi. And as Difu Simo, we also recognize the importance of technology, and we've created an interactive media platform and also social media platforms to be able to reach a broader audience nationally and internationally. And through our work, we've pioneered large-scale mental health interventions in communities in Kilifi, which are directly reached more than 5,000 community members through the mental health awareness walks. We also have participatory video screenings which are done in the community and evaluated through research. We also have community outreaches and school mental health forums. And through local and national print and broadcast media, we've reached an approximate more than 1 million people across communities in Kilifi. And the impact of this work has led to an observed increase in the number of people seeking care in the local county facilities for mental health, and also an increase in collaborations between the traditional health practitioners and biomedical practitioners. And also the story of Mr. Changawa is shared through a documentary, which is called The Man in Chains. And this has inspired local youth groups to create creative works of art, such as drama, to engage their peers on stories about mental health. And the important lesson from our work has been on the relevance of shared learning between the involved stakeholders and the community members. And in future, we hope to set up an audiovisual archive around cultural practices around mental health and mental illness to preserve the culture and also inform culturally relevant interventions. And in the words of a local community member, it is important to involve community members because when you involve the community members, you get the actual situation and not just the theory part of it. And you get to know how it is perceived in other spheres of community. And this is important as we continue to break the chains of mental health stigma. Because Vilalu Siutai, mental illness is not witchcraft. Thank you.
Yes, it's really, really important, Judy. Well done. That is really, really an inspiring talk. So let's see if we have any questions from our audience. Yes, we have 2 questions so far. Lovely.
Hi. So in one of the slides, I saw you're engaging, biomedical staff is engaging healers, right? Can you give an example of that engagement? Like, how do they react, and what kind of case do you present to them?
Okay. So we actually engage both of them in one platform. And when I was speaking about the mental health awareness walks, we actually had a major one last year. And this we bring together the biomedical practitioners and traditional health practitioners together in front of the community because we have these perspectives about the causes and management of mental illness. And we want to engage these both sides, hear from them, and promote collaborations between biomedical practitioners and traditional health practitioners. Because this is also important so that we support these traditional health practitioners who hold a very key position in the community to be able to practice mental health care in a way that respects the human rights of people living with mental health problems. Yes.
Great, fabulous. So, yes, we have another question here from one of our juries. Oh, sorry. We're bringing the microphone right now. Running with the microphone. Yep.
Thank you so much. It seems. Thanks. It seems that many stakeholders are engaged. How do you work? It's presented as a project. Can you just tell us who is actually making it possible?
Okay. Okay. So Difu Simo is a collaboration, and we've worked together to actually make it possible. As I mentioned, we have health researchers. So the health researchers are involved in evaluating the impact of their work through qualitative and quantitative research. We also have filmmakers who are involved in making documentaries, such as the documentary of Mr. Changawa and other documentaries that we've created through our work. And the local experts in the local culture and traditions of the Giriama community in Kenya are involved now in creating the songs, dances, and poems in a language that the community actually understands, so that we use this to engage them through the community platforms. And the people living with mental health problems, actually lived experience of mental illness, then create the participatory videos, which are screened to the community to promote dialogue about, between the community members and the people with lived experience of mental illness.
Who is managing all of it?
Yes?
Who is managing all of it?
Okay, so the management is actually within the KEMRI Wellcome Trust research program. And this project was funded through the Wellcome Trust, and we brought together all these stakeholders together to be able to make the work possible. Yes.
Great. So, do we have any other questions from our audience or from our jury members? Yeah, lovely. So we have another question from our digital jury here.
Exactly, just a second. Were there any interesting or surprising findings, especially from a cultural-specific context, from those screenings that you made with the community?
Okay. I think the most surprising thing was actually the community was ready, and we didn't realize they are ready to actually be engaged in a way that they appreciate and in a way that actually relates to their culture. So they are ready to be engaged, but are we ready to find the right way of engaging them? So that has been the most surprising thing for me through our work. Yes.
Great. So I reckon there are no questions anymore, right? So thank you very much. A massive round for Judy here. Applause. Great.